Starting. All attendees are in listen-only mode.
Hi, good afternoon. Today is April 30th. I'm Donna Will, Professional Development Coordinator for the Developmental Disabilities Administration. We welcome you to the Friday series of DDA updates. Our presenters for today include Bernie Simons, the Deputy Secretary for DDA, and we also have Robert White, Director of Fiscal and Operations. We have Rhonda Workman, Director of Federal Programs. We have Nick Burton, CMRO Regional Director. We have Dr. Kenny Fader, Epidemic Intelligence Service Officer, Centers for Disease Control and Prevention. And before we begin, I'd like to go over a few things about the webinar. All participants are in listen-only mode, and there are two options to hear the webinar: by computer and by phone. If you look at the panel interface on your right, labeled audio, you can click either computer or phone to switch for the best option. There is a handout for the webinar, and you can find it in the handout section, and they can be emailed upon request. We are recording this webinar and we'll post it on the YouTube link on the DDA website. Questions can be typed in the question or chat box in the webinar panel, and we will answer those towards the end of the presentation. So I'd like to introduce Deputy Secretary Simons. Good afternoon.
Good afternoon, and I want to thank everybody for your continued support and attending our webinars. We've heard back a lot of positive comments. They've been helpful. And now as we start the month of May, obviously, we've got two webinars scheduled. And what I'd like to know from people is, since, the state and all of you are making a lot of progress with people getting vaccinated, et cetera, and we'll talk a little bit about the governor's order in a little bit, but to see if you really want to stay with the bi-weekly webinar, or if you would want to go to a monthly webinar from the end of May until December. So, I'm open. I just don't want to, feel like, we are mandating that people should come on, and we had excellent numbers of people participate in our webinars. But, again, this is about how we are moving forward together. So, anyway, just a thought. You can tell me, no, we're going to stay bi-weekly. This is great. And DDA will continue to then do bi-weekly. So just a thought, as, we in a state move better with our numbers, et cetera. So next slide, please. So again, our highest priority is health and well-being, as long as everybody else is too. I mean, we're concerned about people we provide supports to, and people who we don't. We're on our waiting list. And, we've got all families and staff and providers and everybody. So, again, we are committed to being transparent, working with everybody as we, again, go through this over a year now of this journey together on COVID, and, have issues around and discussions around Appendix K and guardrails and all of those issues that we collectively need to move forward. And again, please, even though we are getting better with our numbers, please, let's take a look at continuing to wash our hands and be safe, and in the appropriate venue, continue to wear your mask, please. Next slide. So, as I said, Governor Hogan lifted the outdoor mask mandate restriction, outdoor dining, etc. He also announced that we are going to a new phase of a vaccination campaign, moving into direct scheduling at the mass vaccination sites, which is really good. I mean, I've heard a lot of positive aspects, and many of you may have seen that Vice President Harris was at M&T Stadium yesterday at the mass vaccination site. It was all over the news, and it was a lot of positive. She praised the state in Baltimore for making positive moves. And so, again, direct scheduling at the sites, and here's the link, and that's what we are obviously providing, as well as the 800 numbers on the GoVax. Next slide, please. Okay, so we've got 12 of those open right now. The 13th is opening today in Howard County, and it's going to be at the Mall of Columbia. and it's anticipating a record day of doing 1,000 vaccinations. And so that'd be great. There'd be 1,000 more people in Maryland that will be vaccinated. We also have the No Arm Left Behind that the governor started, and basically going into people who are homebound or need transportation. And again, there's the 800 number. And the call center is available, as you see, 7 days a week from 7 a.m. to 10 p.m. So please pass that information on as appropriate. Thank you very much. Next slide. So again, if you watch the governor's press conference on 2 days ago on Wednesday, he talked about the orders. Here's the links that we provided for your reference, so you can see exactly what it talks about regarding certain businesses and directives regarding regulating certain businesses and facilities, etc. And so obviously we wanted you to have the direct link to see what the governor was talking about in these documents. Next slide. So we talked about this a few weeks ago, that we have, working with the Community Health and Resource Commission, there was Senate Bill 496 that put $5 million out, and we had talked about this. We actually did a specific call with the executive director, Mark Luker, and some of the staff from there and some of our staff, and basically there's an FAQ that we shared last week. And obviously, I just want to remind everybody that there is $5 million. It is in a tiered structure. If you see that, based upon the revenues that you have, will make you eligible for a certain dollar figure. And please take advantage of this. And please note that the applications are due by May 10th. So you got a few days to complete your applications, etc. And so, let's see, next slide. So this week we did post the FAQs for the retainer days. We know that there's been some questions that we kind of reworked the template so it's set up so it's hopefully much easier for everybody to navigate and find answers, and faster by using the table of contents and the links, etc. So, you know, again, I think this is extremely important. We need to make sure that you have the capability of being able to get in and look at this, and the state, we, DDA, making it as easy as possible for you to take a look at all of these pieces of information and be able to navigate and find it easy. Next slide. Okay, so many of you know that DDA has a mortality review committee, and then we have membership seats that are open for the following. We're requesting that we have people who are either in any of these four categories, either call or email, I guess would be the easiest, Nicole Smith. And if you have any information that you want, or if you're volunteering, you know, she's great. She's been with the Mortality Review Committee for a long time, and she's been the staff to it, and knows everything about it, the frequency that it meets, you know, copies of their charter, for lack of a better term, of what their responsibilities are, etc. So again, I think it's an important aspect of DDA. You know, mortality review basically also is a good quality assurance system. You know, when someone passes away and you look at why did they pass away, etc. You know, what was the issues going on? How long had the person been ill? If it was not a sudden death, etc. So, I mean, it's good to go back and look at this and strengthen our system, even though people have passed away. I mean, it should help other people who are still in our supports and services. So, again, I'd ask people to take a look at this and please volunteer. It's extremely important committee. Next slide. We also have reopening. We know that we've looked at this in the past. We started early on. I received a little bit of criticism that why was I doing that with DDA. I didn't think it was too early at any point in time to talk about reopening. Sooner or later, it's going to be reopening. The question is, you can have a conversation without executing your actually reopening of your supports and services. We know that we had to keep distance. We're in a much better place right now than when we had those conversations early on. And, you know, I know that the regional directors have had conversations. There was some this week in some of the regions with a lot of the providers, and what are the challenges to reopening and what does that look like? And, you know, is it staffing? Is it continuing to understand? And I want to stress this, that, you know, I've seen some emails coming around that say, you know, this is great with Appendix K and we can do all of this remote stuff, but when the pandemic goes away, we can't do it anymore. That is absolutely not true. You will continue to be able to utilize that same platform, for lack of a better term, on remote, and it was already in our appendix, our last amendment, and already approved. So again, I'm asking everybody if you would go on and take a look at the survey like we did a year or so ago, and if you could please complete it by the 15th of May. I would appreciate it. I think it'd be great to see what some of the challenges are and what we have as we continue to move forward. Next slide. So as you know, we continue to work, and this is for Nick, not me.
Thanks, Bernie. Well, I think to Bernie's point that he just made, particularly around reopening, one of those tools that we have is to be able to get vaccinated. And as you know, and as we've communicated on this webinar for months now, the DDA continues to work with our different public health departments to coordinate disability-specific clinics. We've been sending out links to register for various vaccine clinics on our Constant Contact, and we've been posting them on our Facebook page as well. There's 2 this weekend that had additional spots available, and I would encourage any of you at provider agencies that have staff or individuals or family members from the folks that you're supporting that still need a vaccine to take advantage of some of these weekend ones. There's one at Opportunity Builders. There's a registration link right here. And there's also one at Kennedy Krieger. And Kennedy Krieger's this weekend is a little bit different than what we've seen in the past. It's a drive-through clinic. And so I really encourage you, those of you that have been reaching out to say, hey, help me get a vaccine, please register for these vaccines. It's important as we look at reopening, but it's just important as we continue to reimagine life after COVID. So thanks, everybody.
Okay, thanks, Nick. Next slide. And so this is basically what we've been doing with updates with the region. So I just want to continue to give you an update, and this is as of yesterday. So the Central Region has 874 confirmed positive for COVID, 1,275 negative, and 53 people have passed away. In the East Region, it's 151 positive, 435 negative, and 6 people who have passed away. South Region, 629 positive, 240 negative, and 26 individuals who have passed away. And in the West Region, 369 positive, 410 negative, and 17 people who have passed away. For direct support professionals, which may include other staff coming in from the agencies. 420 positive and 5 deaths in the South. West, 209 positive and 2 deaths. East, 225 positive and 1 death. And in Central, 691 positive and 2 people have passed away. Next slide. So this information is as of yesterday also. And obviously the pie chart on the left is what we've been presenting right along with our 17,776 people. And 11% were tested positive since March of last year. And you can see the chart on the right goes down, and you can see how low those numbers are. You know, I think that this is a good reason to say that people have been very, very diligent and making sure that they were washing hands, social distancing, et cetera, because again, this is a cumulative number that we were working with way back when, and obviously this is looking at the whole month of April, and you know, again, I mean, you know, those numbers are extremely low compared to what we've had in the past. Next slide. And so you'll see also here that we have had 0 participants pass away during the whole month of April. I mean, this is the first time I think we've seen this, and you know, we've had 102 deaths total that you can see since the beginning of the pandemic of people who have tested positive. But again, this is, I don't remember seeing a whole 30 days or, you know, in within a straight 30 days of a month. Let me say it that way. It could have been split months and we could have had 0, but you know, again, looking at the number of people who have passed away with from COVID, you know, I think everybody has done a remarkable job in trying to keep everybody safe and being successful with it as much as we can under the circumstances. Next slide. People who self-direct their services. Here are some numbers that we see. Obviously, we've got some data points there that what we are looking at, and continue to reach out to people who are self-directing to make sure that they can either partner with an agency who's having a clinic, and then we know that that's happened in some places, and we also are looking at additional avenues to get those numbers increased of people who are self-directing their services. Next slide. Okay, so this is my ask. On the right-hand side, you'll see that we have 560 people who are reported. If you think of the previous slides, we've got almost 18,000 people. So I really need some of you who are provider agencies to basically come back and say, yeah, okay, even if I take the 1,000 off, or a little over 1,000 who are self-directing, that still puts me at 17,000. So we're still between 15,500 and 17,000. So I'm asking that the agencies please respond so that we have accurate numbers and we know how close we are. You can see here that I think we look good, even though the universe isn't as high as it should be, only being the 15,560, but we are at 71%, which is good, which is great. And we've got another 29% that have not received the vaccine yet. We know that there's been 124 clinics, which I applaud everybody who has been running clinics. And obviously we have 3 coming up between May 1 and May 7. Next slide, please. So you can see where we are with family members and administrative staff, direct support professionals, and then 314 of the people that are self-directing. We need to, again, work with SDAN and other avenues and other folks to get that number up with the self-direction, because it is 314. And as I said, we've got over probably close to about 1,200 people. So with that, I'll end my presentation, and I'll turn this over to Dr. Fetter. And Dr. Fetter, again, thank you for being here.
Sure. Thank you, Deputy Commissioner, and thanks everybody for being here. So Deputy Commissioner Simons asked me to come on today just to give a very brief update. First of all, I just want to say, looking over those numbers, all of you are doing such an unbelievable job of working to have your staff and residents vaccinated. So thank you for everything you're doing. As you can see, it is saving lives. Not one death in a TTA participant this month. That's because of the vaccination campaign. It is saving lives. And the other measures that you are taking to continue to keep folks safe as we move through this vaccination campaign. So, mostly what I'm here to say is, as some of you are probably aware, the CDC just this week put out a whole group of new guidelines that deal with visitation in long-term care settings, group activities in long-term care settings, infection control practices in long-term care settings, and also that deal with mask use in public, right? So as you know, Maryland has lifted its outdoor mask mandate, but what persists may vary across jurisdictions. So what I'm mostly here to say is, we have not fully figured out how to integrate that CDC guidance into our Maryland guidance yet. It's going to take a little bit of time because group homes are somewhat different than nursing homes and assisted living homes, which is really who the guidance is intended for. And so we really need to think about what your needs are and how to adapt that to make sure that it's appropriate for the needs of your clients and staff. So those changes are coming. They are coming soon. For the moment, there are no changes, but we are aware of those changes to CDC guidance, and we're going to update our own guidelines and policies as quickly as we possibly can to reflect those changes, and also the changes, the parallel changes that are being made in nursing homes and assisted living programs. And while we do that, we are taking into consideration many of the comments that you've given us about the last rounds, and in particular around the challenges of visitation, because we know that's a #1 priority. So, more to come on that in the future. Probably in 2 weeks. You will probably have the guidance before then. And in the interim, I appreciate your patience. Please stick with the current guidance that exists. The one thing I will say is that with respect to the mask mandate, the state has lifted its outdoor mask mandate. So that goes for the residents of your programs. If previously they can tolerate a mask and you were asking them to wear a mask outdoors, and you don't want to do that anymore, that's okay. They should just follow whatever the rules of their jurisdiction is. So if your jurisdiction continues to have a mask mandate, you should follow it. If they don't have a mask mandate, they should not. For staff, wearing a mask is part of the job. It's part of the terms of, it's part of what's necessary for safety for employment. So it keeps them and the residents safe. So on their own, going about their lives, they should comply with the jurisdiction. But so long as they are working with their residents and could be in close contacts with their residents, they should continue to wear a mask or face covering in any setting where they're working with a resident, and anytime they're indoors. So that's what I'll say about the mask mandates. Is you should follow the mask mandate as it exists in your jurisdiction. If there are questions, I can briefly try to take some questions. But I apologize, I'm going to do a lot of hedging because, like I said, a lot of these guidance updates and changes are going to come over the next week or so.
Thank you, Dr. Fetter. Appreciate that. Next slide, Donna. This is an opportunity for you guys, if you could, this slide shows all the resources that have come out from the CDC. It gives you the overview. It also gives you yesterday's most updated information on the guidance on the full vaccination of people, and then it was revised. It was sent out on the 27th. It was revised yesterday. So all this is the current documentation or information and links from the CDC. Next slide, Donna. So this one, again, Bernie said, we have 2 more meetings for the month of May. We have gotten folks to type in the question box whether they want to have this either biweekly to continue or monthly. So far, we've gotten 5 responses, and we have about a little over 466 people on this webinar. So please type in there your preference so that we can tally and we'll make a decision on majority. So please take that opportunity, and we will then be sharing the dates based on what everybody votes today. And then let's open this up for the questions for Dr. Fetter. Let's see, we're going to look through and see if there's any specific questions for Dr. Fetter right now.
So there's a question, do vaccinated staff need to wear face shields?
Yes, there's no change to the guidance at this time around personal protective equipment.
Okay. And again, I think it had also too about face shields and goggles if they're working with individuals who've been vaccinated. So Dr. Go ahead, Rhonda.
I was just going to say, we also had a suggestion that HCBS, so Home and Community-Based Service COVID guidance, should be the same or less restrictive than CDC guidance for nursing homes. That was a suggestion.
Okay, and those would be all the questions that I have in reference to Dr. Fetter. I think everything else goes to then the FAQs from the retainer days. And if anything else comes up here in reference to Dr. Fetter, we will share that with him so that we can provide you the answers through an FAQ. Okay, so let's go then to the questions that we've received so far. The first question is for Robert. Since some of the information in the FAQ released yesterday about retainer days changed provider understanding of their guardrails, will error updates for FY20 retainer days billing be accepted after Monday, May 3rd?
I'm going to ask Ron to chime in on that particular question.
So thank you, Robert. So the question was, just to restate and make sure I got the question, will the error updates for FY20 be accepted after May 3rd? Was that the question, Patricia?
That is correct, Ron.
Okay, so we set the deadline for May 3rd because we wanted to try to give providers enough time to complete their FY20 cost reports, which are going to be due, by May the 31st. So, we moved the date again to give a little bit more time because, we had to update the FAQs and the guidance. So that's why we set the date for May 3rd. And we really, really need to get those in so that we can get the cost reports, done and start working on those.
Great. Thank you, Ron. This next question is for you too. If the attestation for retainer days are to be done quarterly, then why are March retainer days considered part of the April through June quarter? This causes an issue with the timing of guardrails for providers.
So the attestation period, the schedule, what we did, again, we revised the schedule and updated the schedule to include the FY20 period from March 13, 2020 through June 30, 2020. And that was based upon the, the subsequent guidance we got from CMS that the guardrails were retroactive to March 13th. So we went in and added that as an additional attestation. And the April 10th date, which was the first one that was due, was to, to reflect the period from the start of the fiscal year, July 1, 2020, through, to bring us up to the current period. So we set that attestation schedule. And from that point forward, I think each attestation, we tried to do it and set the dates along with the schedule of the quarterly payments. Not that they are related, but just to, keep everything kind of aligned so that, it would ping providers to know that, as they're preparing for the quarterly payments process, that, those attestations were going to be due around the same time. So we tried to align it with the quarterly payment scheduled payment process.
Okay, the next question is for you, Ron, too. For retainer days billed by providers that did layoffs, I understand 60% of retainer days can be billed. However, does this mean 60% as in 18 out of a potential 30 days, or 60% of 100% of revenue instead of the 80%? Or is it 60% of the 80% of retainer revenue?
It's 60% of, so if we're talking about DAHAB, we know that the initial guidance we gave was that, providers could bill get 30 retainer days for DAHAB at 80% of the rate. And so with this additional guidance for the guardrails, that means if you bill, for example, $100 for DAHAB for retainer day, and at the same time you had staff layoffs during that period, that during reconciliation, we would be recouping make an adjustment to recoup the difference, so that you would essentially get paid $60 and $40 would be recouped.
Thank you.
Thank you, Ron. Robert, this question is for you. If we can show that COVID relief money received during the same quarter as retainer day money billing was not used for the same purpose or expenses in the same time period, does this mean we can attest that we meet the other funding received guardrail?
Yes, I saw that question earlier and made myself a note to, I need to research that a little more.
Great, thank you, Robert.
You're welcome.
Dr. Fetter, are you still on? I just want to be sure. Okay, we got some for here, so I'll send it to him. Thank you. So let's go to the next question. And this one is for Robert. Why does the guardrails regarding other sources of funding refer to unemployment? Is that reference of the CARES Act coverage?
Sure. So unemployment would also count as another, like a duplicate source of funding. So it's those two points that CMS continue to underline, not using more than one source to support a program, and making sure that, agencies don't find themselves in a position where they're profiting from the public health emergency.
And there's, I could just dovetail on that. And there's really kind of two aspects to the revenue piece, right? So it's the I think they mentioned the duplicate uses guardrail, and then there's the the revenue in excess of your let's say normal revenue, or revenue that you had in the quarter prior to the public health emergency.
Thank you. Ron, this question's for you. Do providers need to fill out Schedule G on the cost report for retainer day changes? If so, that would result in thousands and thousands of line items. Schedule G asks for daily attendance changes for every consumer.
That's absolutely correct. Normally, when we have those discrepancies between the provider record of attendance and what is reflected in PCI-S2, we do ask and require the providers to give us the line-by-line detail explaining those discrepancies. But given the public health emergency and the situation we're in, we're going to consider we're going to be, I think, a little more flexible in that regard, realizing that we are in an unusual kind of time and situation. So we may look at doing more of a lump sum kind of explanation, maybe, and attaching a note in the cost report or in the form itself on Schedule G.
Thanks, Ron. The next one, it's for you guys. I'm so, all this is for Robert and for Ron. This one is, we went through the reason, when we went through the recent presentation in reference to emergency relief grant, I think that there was a question on DDA recouping the money grant amount when doing annual reconciliations. In other words, DDA fees for service payments will be reduced by grant amounts. My understanding was that they would do so and would treat grant amounts as additional revenue for providers. Please clarify.
No, so we don't. So the only thing that would be recouped would be retainer day revenue. We wouldn't be recouping or touching any other source of revenue from the provider. That's the provider's revenue. The only thing that would be subject to recoupment would be retainer day revenues as a result of the provider billing those retainer days, and outside of what those guardrails require.
Thank you, Ron.
Thank you, Ron. The next question is, are we able to claim retainer days between March 13, 2020 to March 31st, 2020 if we receive a PPP loan in April, if March attestation is to certify in April?
So so the question is, if you bill retainer days during that period, and remember there are two aspects to the revenue guardrail. You got to consider your revenue, because the overall, remember, objective in the guidance from CMS was that the agency should not profit from the public health emergency. So just because you may bill retainer day and receive additional support in another month after that, if that revenue that you got from the PPP plus the retainer day that you bill causes you to exceed that guardrail about revenue when you compare it to the quarter prior to the public health emergency, it could be subject to recoupment.
Okay, the next question, Ron, is for you. Is if we receive PPP money in April of 2020, even though it only covered 10 weeks of payroll, does that disqualify us from entering an Appendix K period, an entire Appendix K period?
Not necessarily. If you receive the PPP and it is, it meets the duplicate uses guardrail where it's used in support of the program, but it's not a duplicate use for the same purpose, then you may be able to meet that guardrail. But the other question, as I said before, is does it push you over the threshold when you look at your revenue compared to the quarter prior to the public health emergency?
Thank you.
Thank you. The next question is, it's a follow-up question to the 60% retainer and personal supports. It says, so if we have laid off staff, we can only take 60% of the retainer, which should be 72 hours of the 120 total hours. Are you saying that we would need to input retainer for the full 120 hours, even if we know 60% is 72 hours, since DDA is planning to take back 60% of whatever is billed?
So if you put the 100% in, we're going to make the adjustment and to reflect the the recoupment. But if you make the adjustment yourself and only bill the 60%, whatever it amounts to, then that will already have been taken care of. But if you bill 100% for that service while you've laid off, then yeah, we're gonna make that adjustment at reconciliation.
Ron, can you clarify the difference between 60% of the rate versus 60% of the allowable hours?
Well, the sort of rate, 60%. What we're saying is, on the 60%, we're saying that whatever revenue you've received as a result of billing those retainer days, that cost on the books when it comes in, we are going to adjust that by that difference. We're going to make an adjustment such that you will be paid 60% of the cost of that service. That's simply what it means.
All right, the next question is, will recoupment happen if provider receives funds for shared time for keeping residents during the day and PPP?
I go back to the guardrail of it really boils down to a question of revenue. Revenue in terms of is it a duplicate purpose? I mean, is it a situation where you've billed for retainer day and you've received another source of revenue to provide that particular service? If you did, then that is subject to that guardrail. And then again, the other part of the revenue question about exceeding your revenue prior to the quarter prior to the public health emergency. If none of those are true or the case, then it wouldn't be in jeopardy of being recouped.
Next question is a follow-up to the Schedule G. The question is, when will we have final clarification on whether or not we can summarize this information based on what you said, Ron, in terms of the DDA looking at maybe a streamlined process?
Yes. I'm going to be talking with Robert, excuse me, probably sometimes after this call, is later on this afternoon, about the cost report. And so we hope that we'll have something coming out on Monday.
So Ron, the next one is a statement and a question. So if an organization is not allowed to profit according to your statement, then why aren't expense factored into the equation?
I'm not sure I understand. If an agency is not allowed to profit, why are expense factored into the equation?
Why aren't they?
Why aren't they? Oh, well, I think what CMS is saying, they're looking totally at revenue. They're looking totally at revenue. And I think that what they're suggesting here with respect to the retainer day is really not, largely different or radically different from some of the kind of financial controls that were in place even before the public health emergency. I just think that the guardrails kind of were, you know, required by CMS given the time that we're in, and, you know, the need to kind of, you know, increase some of these retainer days. So they're looking at revenue to just make sure that, like I said before, that, you know, that agencies are not, you know, financially benefiting by using these multiple sources of revenue for, you know, during the public health emergency.
Ron, the next question is, will DDA back out rate increases and expansion funds, excuse me, when considering the benefits from the public health emergency guardrails? So will we back out rate increases and expansion funds when considering the benefits from the public health emergency guardrails?
No, we're not considering backing out expansion funds, or because really the question is, so the expansion funds and you know, other things, I guess the point that the question is making is that you know, by virtue of rates and maybe increased activity, that an agency could realize, I guess, revenue growth. But you know, the quarter prior to the public health emergency would have been, you know, I think that the agency would have realized, you know, whatever, you know, its regular revenue for that time period, and expansion of activity and service. I think that when the agency, when you submit your attestation, if you think that there's a clear case that you can distinguish and show that, you know, there's been no revenue growth associated with the retainer day or some other PPP supporting the program, then you know, I would welcome the agencies to make that distinction in the, you know, in their cost report.
Okay, the next question is, can you clarify what is considered as total revenue for comparison purposes? Do you mean total provider revenue from all resources, or total combined revenues from DDA programs only?
Well, for comparison purposes, the guidance that we receive is that total revenue is in play when you know, the agency is billing our retainer days, and, you know, then realizing that retainer day revenue, that they are, you know, their total revenue is subject to review. Now, in terms of the, you know, the duplicate uses component, I think it's possible that, you know, the agency can have, you know, PPP or something else, and maybe bill retainer day for separate, you know, things or purposes, but just can't be commingled with it for the same purpose, because that becomes subject to the guardrail. But the guidance we received from CMS was that we're looking at total revenue for, you know, for the agency and the programs that they provide on behalf of DDA.
Ron, the next question is, when will the recruitment take place? Payment on retainer days on error and update reports submitted have not been paid as of May 31st.
Right. So we would have to look at because by the time, quite frankly, we get, the cost reports being due not until May the 31st, and by the time we process and get through, those FY20 cost reports, we're probably looking, somewhere well into, next fiscal year. I can't say exactly off the top of my head, but, obviously we're kind of behind in our schedule, because in a normal situation, we would have received most of the cost reports by December the 31st and be well through processing most of them by this time. So, and be prepared to make those adjustments in the next available quarterly payment, which would be July 1, 2021, which is FY22, first quarter of FY22. So we're looking at, I don't know how long it's going to take us to really kind of get through processing these cost reports. So I think what we will need to do, and I'll talk further with Robert about it, is because we're in such a unique and unusual situation, I think we'll put out some, just to kind of keep all the agencies in tune with how we're processing on this, to let them know, where we are and how we're going to do these recoupments. And, we may even look at trying to come up with a time frame at the same time to kind of roll out for everybody.
All right, Ron, the quarter that we must compare to is October, November, December 2019, or January, February, March 2020.
It's March the 13th is when the public health emergency started. So it starts with March the 13th, 2020.
Thank you.
Ron, I think the question was asking the comparison to what the revenue was prior to the public health emergency, the quarter before it started. What is that time frame?
Yes, that would be through December. So it would be October, November, December, right? That would be the last full quarter prior to the public health emergency.
Can you repeat what those are, just to be so clear?
Yeah, October through December 2019. That's correct.
So it's October, November, December of 2019.
The next question is, so if we only bill 60% of days, 18 out of a potential 30, that will be only 60% of the 80% total retainer if we had layoffs. So it sounds like we're talking about 60% of days versus 60% of the rate.
Well, again, as I said, we're talking about, so we're looking at doing the adjustment and the recoupment on the back end. So when the expenditure has been incurred and you submit your cost reports, we're just making an adjustment by the, to allow the agencies to keep 60% of whatever was billed for the retainer day. So we will make that adjustment in the reconciliation by, 40% recoupment.
So I think, we're getting a lot of questions, and we want to make sure that we are clear in our message and gives Robert and Ron and our team an opportunity to vet some of these questions, because I don't want people to say, well, you said this and this sentence says this and paragraph said this, because I'm getting lots of that. And there's a lot of clarification of a clarification. So I don't want our audience to be confused, and I want us to be very consistent with our message. So I'm going to wait another few minutes for you to please type any specific questions in regards to the retainer days, guardrails, and all of this, because we want to make sure we're consistent We want to also make sure that some of these questions that were repeated or either the same answers we given in the FAQ. So for consistency, I'm going to stop reading some of the questions moving forward, give you an opportunity to type them in the box here so that we can continue to aggregate them in the FAQ, Ron. That way we can really vet them and go through them. I'm just going to look to see where there's clarification, because I think that there's some things here that we really need to touch base with Robert and our team to make sure we provide guidance. There is one here that I can read out loud, and it says, can you please confirm if the early adopters will be the first group to implement the new LTSS rates for the meaningful day, community living, etc.? All other providers will still have to use the PCIs to this new fiscal year. Ron, do you want to answer that?
I'm sorry, Patricia, could you repeat that question?
Yeah, I can.
I can give it to Robert. Robert, go ahead.
Yeah. So yes, all of the early adopters who go into the system will bill 100% in LTSS, and obviously, if you are an agency who's not part of that early adopter group, then you just continue billing as you are today. I also want to add, there's been several questions about lines of credit. I've been in contact with our Medicaid department, and we want to confer with CMS just to make sure we don't recall them prohibiting the inclusion of personal or business lines of credits. They weren't very specific, so before we try to put something out there, we want to just go back to them and ask that specific question.
Thank you, Robert. So I think what we'll do is I'm going to wait. We have about 3 more minutes. I'm going to leave the webinar open for another 5 minutes for you to type your questions, so that way we don't want to create more confusion. If you think that you are confused about a specific answer, please retype it in the question box so that we can be sure that we are able to address it and provide some clarity in the FAQs that we will continue to update as we go through finalizing and retainer days and go through the state of emergency. So as you do that, I'm going to flip it over to Bernie for his closing comments, and then we'll just keep it open just for a few minutes after Donna. So Bernie?
Well, I don't know what we have for responses in the chat box for the frequency of the meetings. Tricia, can you take a quick look at that?
I sure can. Yeah, so we have, I was Italian, and it looks like the majority is saying monthly, to go to monthly meetings. There's just a few who said the biweekly, but they love the biweekly, they like the information, but the majority says monthly.
Okay, well, again, I want to thank you for all your feedback. I want to thank you for the participation from March of 2020 to current, all the hard work that you're doing in keeping people safe, in thinking about reopening plans. We've had a good opportunity to have Dr. Fetter on many of our webinars, along with some of the providers who have talked about their experiences in either shutting down or what day-to-day life looked like with changes during the pandemic. So again, we'll get the questions that are in the box. I know that there were a lot on retainer days and guardrails, and Robert and Ron will work on some responses, and we'll get them out. With that, I have 2 o'clock. I wish everybody a healthy weekend. Stay safe. Hopefully the weather won't be too bad. I know it's a little windy out there today, so hopefully people can stay safe. And again, thank you for all of your support and being on these webinars with us. We really appreciate the engagement and the suggestions for topics. So.
Thanks, Bernie. Donna, let's do 3 minutes and then we'll close it.
Okay, I'm going to close the webinar.
All right, thank you, Donna.
Okay, have a good day.
You too.